The case that I was involved in was a young woman that I took care of in the emergency department who came in about 26 weeks pregnant complaining of symptoms of simple cystitis, or lower urinary tract infection. We made sure she was safe, there was nothing else going on with her medically, and we sent her home with follow-up with our OB doctor in one day and a prescription for antibiotics. Unfortunately, the next day she came back to the hospital in preterm labor and delivered a severely impaired baby that requires long-term care.
The patient claimed in this lawsuit that she should have been monitored for early signs of labor, that she should have been referred to the labor and delivery unit at the hospital, where she could have been monitored with specific equipment to rule out contractions and other signs of labor.
This case was always difficult from the very beginning. The reason it was difficult is because there was a lot of sympathy involved with an outcome like this. Everybody who takes a look at this case will feel that in some way and may have the tendency to decide based on a bias what should or shouldn't have happened.
When we are involved in a situation and take care of a patient that has an unfavorable outcome, we tend to do a lot of self-reflection. And I did so in this case. And I think that's what was difficult about the case. I did practice the standard of care. I did everything I possibly could for my patient, and yet there still was an unfavorable outcome.
I thought we had a strong case going into trial for several reasons. First, Dr. Gupta. I knew going into trial that he was going to make a terrific witness, and in fact he did. Secondly, I as the lawyer have certain tools available to me, but the doctor's company provided those tools and was an invaluable team member in presenting the defense of this case. And thirdly, we had what I think were the best experts in the various fields that were needed in this case. We had the best experts in both emergency medicine and obstetrics. This was not only a very sympathetic case, but it was a very high exposure case, meaning that there were tens of millions of dollars at stake. And whereas some insurance companies may have tried to settle this case before trial, the doctor's company was willing to take the financial risk. Dr. Gupta certainly wanted to go to trial. He wanted to clear his name. And the doctor's company, in a show of support to Dr. Gupta, its insured, allowed us to take the case to trial despite this big financial risk. And that risk paid off because we were able to go to trial, get a defense verdict, and in fact clear Dr. Gupta's name.
I was concerned going into trial. I did have emotional ups and downs. I couldn't sleep nights. It was very difficult. But prior to trial, I knew that the doctor's company, my colleagues, and myself had worked incredibly hard and had given ourselves the best possible chance of succeeding. And fortunately, we won.